Delta Dental of Colorado Foundation's mission is to eradicate childhood tooth decay. The Colorado Medical Dental Integration Project aims to reach vulnerable families who have limited access to dental care due to location, lack of, or limited dental insurance, or transportation issues. Delta Dental of Colorado Foundation awarded funding to 16 organizations, including private practices, federally qualified health centers, nonprofit clinics, and school-based health centers.
The idea is that we can test a care model of integrating hygienists as a part of the medical care team and hopefully reach children at a younger age in an environment that's familiar to them and their families and that's comfortable and convenient for them to access care.
Medical providers are busy, there's a lot to do in a visit, and so to have a specialist in your office that you can pass a patient to help prevent the disease, manage the disease, get the disease to a dentist if needed is invaluable.
Providers are really excited about being able to offer even a broader scope of care to their patients.
It's easier to capture the patients that are coming in through the medical clinic and telling them, kind of hand-holding them and saying, come on, this is where we need to go next. This is also a part of your regular care.
We're working with parents who have children that we've had to send to Children's Hospital for general anesthesia dentistry because all of their teeth are bombed out with cavities. And then they have a baby, and we're able to teach them, let's not let this happen to the baby.
They're coming in to get a fluoridation treatment, and then they find out once their children get a little older, they can get their first cleaning here as well, and they can schedule that alongside a well-child check. That's a very convenient thing for them, and they're pretty excited about it, that they can get their care all in one place.
We see hygienists as the prevention specialists. They're trained in prevention, they're trained in working and educating families, and by bringing them into the medical care team, we saw it as an opportunity to really bring oral health back into the body.
Each of the Colorado Medical Dental Integration practices is different, and so each model is unique, and so it's been fun to work with all the different practices to build their unique model.
When you explain to them that it facilitates access to care for working parents, for example, that certainly, you get a big old smile. It's like, so I can bring my kids, all of them, and they get their well-child checks along with their dental care.
So they're looking at a lot of process measures, from how many kids are they seeing, what types of services are being provided, when was the last time that family or that child visited the dentist, and what sort of needs do they have moving forward. So we're really looking at this child level and at the same time interviewing families to understand their behaviors around oral health, their understanding of oral health. And then over time, we're going to see if those ideas and behaviors change from both the family perspective, the provider perspective, and the leadership.
There are also in-person sessions twice a year where they all come here to Denver and we spend a day and a half learning and sharing together.
It's just been great to get to sit with other hygienists who know what this is like, because this is different. And pick each other's brains and figure out what are we doing right, what can we change, and know that there's a whole support system that is out there, because we're kind of pioneers in it.
We believe that this is the first model of its kind in the country that is of this size, and so we're taking all of these lessons and doing our best to share them with other people, and we see this as being innovative and a new way of delivering care.
In less than 2 years, co-MDI grantees provided more than 16,000 patient visits. Co-MDI will continue to expand access to oral health care for individuals across Colorado. Co-MDI will be evaluated by researchers at the University of Colorado's Adult and Child Consortium for Outcomes Research and Delivery Science over the 5-year grant. Learn more about co-MDI at deltadentalcofoundation.org.